because whatever we are eating is affecting our chemistry, any kind of cardiac arrest. And now fever comes, what happens? If you want to take pineapple, you can. Hello friends, my name is Dr. Puru Dhawan, and in this video we will talk about diet in kidney failure, because in a patient of kidney failure, diet is very important. Even diet plays 50% part of the kidney failure treatment, because whatever we are eating is affecting our chemistry of the blood directly or indirectly. So it's very important for our kidney failure patient to understand how we can control the level of creatinine, urea, potassium, fluid, sodium, chloride in the body with the help of diet. Now let's start with creatinine. Creatinine is a waste material. It's a type of protein which is excreted through our muscles during its metabolism. So if a patient takes lots amount of protein like egg, chicken, mutton, fish, what happens? All this protein gets converted into creatinine during muscle metabolism. So if we want to control the level of creatinine in a kidney failure patient, we have to cut down the amount of protein intake. So in a patient of kidney failure, protein free diet or protein less diet is advised. That means one has to avoid all kind of chicken, mutton, fish, pulses, mushrooms, so that the amount of protein can be easily controlled in the body, so that the level of creatinine can be easily controlled. And if the body of the patient is very weak, then we have to select those protein which doesn't generate any kind of creatinine in the body. So we have to look for those protein which is very much absorbable, easily digestible, easy assimilation. And in that category, there is two type of protein sources. In a weak patient of kidney failure, protein is advised, but that protein should be low density protein. That protein should be easily digestible and easily assimilatable, so that the level of creatinine can be easily controlled. So we advise all patients of kidney failure who are weak to take either milk or moong ki dal. If we take these kind of protein sources, what happens? The amount of protein can be easily managed, but this protein doesn't create any kind of creatinine, extra creatinine in the body. So we have to take care of protein if we want to control the level of creatinine in the body. Now let's move to the potassium. Because creatinine is a type of protein which is excreted through the muscle, if the level of muscle activity increases, amount of creatinine production also increases. So we have to control the activity of the muscles. So we have to avoid all kind of vigorous exercise like running, jogging, swimming, because all these kind of vigorous exercises creates more amount of creatinine in the blood. Along with the vigorous exercise, we have to protect our body from fever and shivering also, because shivering and fever also creates lots of amount of creatinine in the body. Suppose you are suffering from kidney failure and your creatinine level is 3 before fever, and now fever comes, what happens? Now the production of the creatinine increases and it can jump up to the level of 10 also, 11 also, because of just fever. There is no kidney failure in this case, only the production of the creatinine increase in this case. So we have to take care of fever and shivering also. Now let's move to the potassium. Potassium is a thing which can be easily controlled with the help of diet. Potassium is a thing which gives power to the muscles to move. And suppose if the level of potassium increases beyond 7, what can happen? This high level of potassium can cause muscle fatigue, because our heart is also made of muscles. If the level of potassium increases, what happens? Because of this high potassium level, muscles of heart gets fatigue, and because of this fatigue, any kind of cardiac arrest can be happen. So we have to control the level of potassium to protect our heart from any kind of cardiac failure. So in case of vegetable, if we want to select low potassium vegetable, keep very simple rule in mind. Always avoid rooty vegetable and leafy vegetable. Rooty vegetable like potato, sweet potato, turnip has to be avoided because they contain potassium in high amount. Exceptions are radish, carrot and onion that can be taken by a kidney failure patient. In case of leafy vegetable, we have to avoid all kind of spinach, we have to avoid mustard, we have to avoid coriander, mint, all kind of leafy vegetable has to be avoided, including cabbage. Only those vegetables which are grown as a fruit on a plant or creeper can be eaten, like your brinjal, tomato, your okra, your bitter ground, round ground, snake ground. Any kind of vegetable which is grown as a fruit on a plant or creeper can be easily eaten because they contain potassium in low amount. In case of fruits, we have to avoid few fruits. We have to avoid all kind of dates, we have to avoid all kind of dry fruits, we have to avoid kiwi, avocado, we have to avoid coconut water. Rest fruits can be taken, but the amount of that fruits has to be limited to up to 1 cup. Suppose you want to take papaya, you can take 1 cup of papaya. If you want to take pineapple, you can take 1 cup of pineapple. If you want to take any kind of other fruits like apple, chiku, other fruits, you can take up to 1 cup. Make sure the quantity of any fruit should be 1 cup. If you want to take any kind of salad along with the fruit, like you want to take carrot and radish, you can also take that, but that should be limited up to 1 cup also. Suppose you want to take some kind of salad, but that salad should be counted into the category of fruits, so that the level of potassium can be easily controlled. That means if you want to take fruits, you can take 1 cup of fruits. If you want to take some kind of salad, that should be also 1 cup. So you can take either 1 cup of fruits or 1 cup of salad, or you can mix both of them, but the quantity will remain the 1 cup. Now I hope you understand how to control creatinine and potassium in the body, because these two are very important to be controlled in each and every kidney failure patient. If you have any kind of doubt regarding kidney failure, you can simply ask our doctors on the number given below. You can also book an appointment with me on the same number. The rest of the topic regarding how we can control the level of fluid in the body, how we can control the level of sodium chloride in the body will be covered in a next video. Till then, allow me to say goodbye. See you in the next video.